wash.
May spine din naman si David.
Oh. Rinse.
Ay,
And
bakit nag-photo? Video dapat. Back massage.
okay, rinse.
Ganyan
Okay, then we will do the back
Nagaganyan ka.
massage or the back care. Okay, what are the two positions allowed for doing back care? Two positions.
High powers.
Ano tawag doon?
Prone.
Position
Ah,
and
okay.
Lateral.
Lateral.
Side or sideline position.
sideline.
Okay, you have 4 different types of massage. What are those?
Effleurage. Petrisage. Petrisage.
Effleurage.
Effleurage.
Petrisage. Tapotment. And
Tapotment.
deep friction massage. Okay, now let's do the later na. No, before doing the back massage, okay, first is you need to assess the pain of the patient. Okay, Mr. David, I'm going to do the back massage, but please, can you tell me what's your pain scale right now? From being 0, no pain, and 10 being the highest level of pain. So what's your pain scale?
0.
So maybe you will tell 5, 4, or what? Okay. Make sure that after doing the back care, you will lessen the pain. You will increase the pain. Okay. So for example, 5. Okay. Then put lotion, oil, whatsoever. Okay. Put it on the hands. Okay, to warm it, and then do the different types of massage. Okay, what type of massage is this one?
Effleurage.
Effleurage. Okay. Okay, effleurage is gliding movement using your palm. Okay, what do you call this?
No.
Patrisage.
No. That's deep, no?
Parang
Deep, deep, ano yan eh?
What is this?
Tapotment.
Ang petri, ang ano,
Okay, this is
ganun.
also a good way
Ganun, no?
to mobilize the secretions. If you have a lot of secretions, phlegm, this is a good way to mobilize the secretions. So the patient.
How do you call it, Miss Ed?
Tapotment.
Tapotment.
And lastly, you have the deep friction massage. Deep friction massage is using your thumb. It is deep, okay?
It's deep, like you.
Deep friction and deep massage.
Halos same lang.
Ganito lang din.
Then, wipe the excess
Yung ano nga yun? Ano yun?
oil. Okay, then assess, evaluate the
Parang
pain.
naghahanap ka
David,
nila.
how,
Ginaganyan.
Ganyan yun.
after doing the back care, how much is
Sarap
your pain
nito.
scale?
Like that.
6 now. So,
Pamassage
tumaas
niya
pa.
ako dyan.
So, it increased, so your back care is not effective. Okay? Now, let's put the patient on this side.
Madam, we have done nothing. You repeat or what?
No, don't repeat.
You leave?
Yeah, leave.
Yay! Your favorite.
Give.
Promotion only. Ha, Ruth, it's only a promotion. One time only. Do not repeat.
Yes.
One time only.
No need.
Don't worry.
Now we will remove the diaphragm because we will clean the buttocks. Okay, so technique. Okay, listen, guys. So, if we are removing the soiled diaper, what we are going to do is that unfasten it, fasten the strap. Okay. Okay.
My poops.
Then, if there is a poops.
She's asking me.
There is a poops.
Mr. David,
Babae pala.
No, she makes bad.
I need what?
We got it. Mr. David. My
It's
polycarbonate.
very big, but when it comes,
Miss-
they are very small.
Mr. David is transsexual, okay? Yes.
Transaction. Slang. Islam.
Okay, you tuck it inside. Okay, then wipe one stroke only down. Okay, from front to.
That's for female or male?
Yeah, female and male both. Okay, if kung may edits dyan, so edits mo. Same. Okay? Mamaya, I will detail how to. This is only wiping, ha? Wiping only. Okay, wiping.
Ay, ginoo ko. Ay, natabang.
Okay? Then, if we want to turn the patient on that side, okay, what we are going to do, okay, we want to turn there, what we are going to do, okay, you need to tuck it inside here. Okay? If the patient is able to turn himself, tell Mr. David, you can hold the side rails. For example, if you are alone changing the diaper, the patient can turn. Okay? Tell Mr. David to hold on the side rails and turn. Okay? So you can remove on this side. But if patient cannot do it alone, of course, you need someone to help you. Okay? To help you. Okay? Then, remove. Okay? Now, it's easy to remove. Okay? Because you tuck it inside. Okay? There's poops also. Okay, we'll use it. It's new, ah. Okay.
Down to up, ma'am?
O ganon. Okay, not like this. Because you are bringing back the microorganisms on the vagina. Vagina is clean than your anus. Okay?
True.
Okay, now,
Balik.
still we are not finished with the wash, rinse, dry of the buttocks.
But there's something there underneath kasi baka
Yes, you can put disposable.
Rubber.
No, this one. Okay?
And
We can do wash, rinse, and dry. Put this. Because we will do the wash, rinse, dry. So first, you wash this one, wash this one, and then wash. Okay? Cheeks first, then this one. Why? Because this is clean than this one. And it should be on this direction, not going.
Just only once.
Once only. Once.
Stroke.
One stroke. Okay, then rinse and then dry. Okay, after this we'll do the perineal care. Joy. Okay, now turn the patient. Okay.
Is that question?
Open na. Yes, ma'am.
Ngat-ngat.
Naubos.
Finish
Kakaliga.
perineal care before you put another
Diaper.
disposable.
Yes. Perineal care muna before putting.
Pero may towel pa rin po.
Ah, you mean? Later. Yung disposable when you are putting. Okay, later.
Mr. David is so fragile.
Okay, now, we'll do the male
Fully
first.
cut ito.
Tanggalin muna natin to. Kunyari wala siya. Okay, punta muna tayo sa male. Yes. More
Touchable.
small. Give me this.
Kanya kalaki sa Enel.
Yeah.
Maliit pala ni. Ano ba yan ni?
Okay na yan.
Hindi pa daw nakatayo.
Okay na yan.
Putaan, jutay.
Jotay. Ako yung model niyan.
Lang dyan.
Ayan.
Renta nito 50
Joy.
Join your tigaw.
Ah,
No watering. No watering of plants. Flowers.
May jowa daw yan dito.
Okay. What is the position of the patient? If you're cleaning the perineal area. What is the position? Supine. Huh? Supine. Okay. Supine position. Supine position for male and dorsal recumbent for female. Okay, let's go with the male first. Okay, if you are rinsing it with water, okay, thorough with water, you can put underpants. Okay, but we are using only the towel. Okay, it's okay because it's not that wet. Okay, compared to if you are putting like that. And you have this towel. Okay, then, okay, I'll tell you the different parts of your okay? Okay, this is your
Urethral orifice.
urethral meatus orifice or urethra. Okay, then this is
The head.
Glans penis.
I will kill you.
Goy?
Joy. What is this?
Glans.
Glans penis. Okay, glans penis. This is
Shaft.
scrotum. Under the scrotum and the
Perineum.
anus. Okay, anus. Okay. If you are uncircumcised, you will not notice that there is glans penis. Okay, do you know how glans penis is developed? It's because you are circumcised. If you are uncircumcised, you will not notice a glans penis. Why? Because glans penis happen when there is a circumcision, okay, and then they did like this and then they put something here. That's why there is glans penis. Okay? So if you have glans penis, okay, you are circumcised. Okay, you are circumcised because I saw how they did this one during our college days. Okay, we assist for
My
circumcision.
God.
We assist for circumcision. Okay, so what are the sequence of cleaning your perineal, male perineal area? You start with the urethra, glans penis, shaft, and scrotum. Okay, be gentle with scrotum. Be gentle. Correct? Sabi ko, di ba? It's very painful when you press it too much. And remember, the scrotum is, what's the function of scrotum?
Produce.
It encloses your
Testes.
testes. Wherein there is your sperm
Sperm
is
cell.
there. Okay, the life is there. So when you're pressing it,
Don't kill the life, okay?
so you're killing the life. Okay, you're killing the
Just
life.
tell.
Okay, now.
Killing children.
Oh my goodness, Ruth.
Tingnan mo, nakapesto na eh.
Baka nakatayo dyan, ha? Neil.
I will allow you to rent this.
Just,
I'll give it to you.
okay.
Next week I will bring it back.
Disinfect it. Disinfect it after you use it. Okay?
If
Ay,
you are
nako.
taking video,
Okay.
even that one, they are going to post that. You can't read it, eh?
Okay. Wash, rinse, dry. Okay. What is the right technique when you are holding this one?
Magaling ka dyan pag
Okay.
Magaling ka
Okay. How you will hold this to prevent erection? Where to
hold the head.
How you will hold it to prevent erection? That's why erection will happen. Okay, ma'am. How you will hold it?
Just to hold.
Yes, ma'am. Go. Sir Reynald. Grabe naman, diring-dire. Madam.
Uy, bawal yan. Nakasila ka.
Pwede yan, pag-aaral naman. Okay. Okay, so what is the, how you will hold it? The correct way is using only your 2 fingers. Okay, don't do like this, guys. It definitely, it will stand. Okay, it will stand. Okay, why? Because there's a lot of nerve endings. Okay, nerve endings. When you're touching that nerve endings, it will be the trigger the erection of your okay, erection of the penis. So the less you hold it, the less it will erect. But there are some conditions which you cannot control. For example, I have a problem with spinal cord. Okay, spinal cord problem, condition, spinal cord injury. Okay, you know that every time every morning, okay, or it depends, no? it will always erect. Especially in the morning. Actually, even
Yes, ma'am. That is the best
even
time to
best
do it
time
in the
to
morning.
erect.
Yes.
It's very big.
Really? 6 o'clock?
You know, I know this Africans they are
They have huge
Yeah, it's not good.
ABC.
Small is better.
really. I have one patient, very big when it's erecting. It has spinal cord injury. And it's very big. At around 5 or 6 a.m., it erected. Okay, it's erected. So, I defer the procedure. You should defer it. Okay? Ethically speaking, you should defer the procedure if you saw penis erection, penile erection. You should defer the procedure. Then come back if
So you just need
it's
to
dead
cover.
already.
When it's
You
calm.
just need to cover with towel and wait like 10 minutes.
Yes, it's unethical to do that. Okay? Okay, Joy?
Yes, ma'am.
Okay. So now how we will do it. So wash, rinse, and dry. So hold on this part using circular motion on the urethra. Then going to what's this? Glands cleaning. Wash.
Ma'am, what if during cleaning and then
Yeah,
it's
erect.
erect again? Because this one is very sensitive.
Defer.
Ah.
Defer.
Yeah.
It's true.
It's true.
It's
You're
true.
gonna tell the patient that you have to come
Defer.
back.
That time you will know if it is really big or no.
Don't come back. If you're finished, don't come back. No. I'll come back. Sabi mo na.
Ano sabi niya?
Just cover the patient.
Talagang parang ganito.
Especially if the patient has a problem with spinal cord.
Sabi ko nga
Column,
sa'yo,
a spinal
nasabog
cord
ng titi,
injury,
tulog
okay, they
kami.
cannot control it. Okay. Erect, then erect pass.
Wala na, no.
Of course.
Wait lang. Mag-train na ako ng ano.
No pharmacy.
Dito lang ang hindi. Here in UAE, they are very particular with the male patient, female. But if you want to go to other country, of course, nothing. Maliban na lang kung nakaabaya ko or yan. Very special consideration. Kasi, of course, they are Muslims. Pero if you are working in UK, US, nothing. Okay? Nothing. You will be assigned to anyone. Sige lang.
Saan kayo naman?
Okay? So, next wash. 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 Under. Wash. And then going down. The anus. Okay? Then, for example, this is our rinse. Okay. If patient wants to rinse with the real water, okay, you put incontinent pad. Okay, put
Yung ano,
Bedpan.
bedpan. Okay. How you will put the bedpan? This way. Okay. Yung mas mababa, the lower side should be put inside. Okay?
You can wash.
Then you can wash with the real water. But if it's only towel, no need. You have this.
Ma'am, where you put exactly this one?
Hmm?
Here you have to.
There's a
Pwede rin dyan, pwede rin or table. Okay, rinse. 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 And going, of course.
What if it takes a minute?
10
it takes
years
hour.
na. Huh?
What if it takes hour? I mean it, ma'am.
mini.
But,
Hour?
yeah.
Mag-erect?
What if this one it will erect and then what if it takes a minute? You have to wait, ma'am.
No.
No, it takes a minute.
To,
Yeah. Calm down.
To relax.
How many minutes?
Maybe.
How many minutes does it need, ma'am, after we resume the procedure?
Just
From
check
erection.
after an hour.
After an hour.
After an hour, you check. If still, but possible it's not erected anymore. 1 hour is too much, actually.
10 minutes maybe.
Okay. Then, so we finish this and we dry. Okay. Then, let's go with the female.
May dila.
Okay, what is the
That's one is the tongue. Okay.
Ano daw?
Tongue.
Yo,
Say something.
what tongue?
Okay.
body of the
What is the position of the patient?
Dorsal recumbent.
Okay. Dorsal recumbent is like this. Okay. Now, we're going to
Do a diagonal.
diamond shape. Masyadong mahaba ito. Okay, ganun mo daw.
Paikot mo siya pa.
Cover mo. Okay, so what we're going to do is this, the corner here. Okay, then roll it. Masyadong maikli. Roll it and then put it here. Okay? Hindi siya kaya. Ito mo na. Okay, kaya mo na dito. Maikli. Very short. Then, expose it. Okay. So, this time, you can put...
Maganda pala yung position niya niya.
Wala, no?
Position niya.
Position ko, gitna ah.
Okay? Then, same procedure, wash, rinse, and dry. Now, let us be familiar with the
Vagina.
parts of the female perineal area. So what they call this?
Labia majora.
Majora. Okay, the big one is the majora. This one,
Minora.
minora. The small one. If you open this, okay, this is called
Clitoris.
clitoris. Okay. Then
Urethra.
urethra.
orifice.
Where is urine coming? Passing the urine, and this is the virgin. Sabi mo, vagina. Okay.
Vaginal
This is the
canal.
vaginal orifice or the vagina, and this is the
Perineum.
anus.
Ay.
Okay, anus. Okay, now. Okay. So, wash, rinse, and
Ma'am, di ba papaihiin mo na siya?
yes. You should ask the patient if they want to pee.
Pee.
Okay, correct. Before cleaning, because the tendency is if the patient pass urine during the procedure, okay, nonsense. You need to repeat everything. So you should ask the patient to pee.
Pee.
Okay, pee or poo.
Pee lang.
Pee. Kasi tinanggal mo na yung diaper.
Tinanggal mo na.
So, if your patient is female, you will use it. Okay, you put like this. Okay, then the patient will pee. Okay, if the patient is male, you will use the urinal. Where's my urinal?
Ito na oh.
Hindi yung
Hindi.
ano, bote.
Urinal is
Yung parang ano. Yan.
Okay. If the patient is male, okay, the patient wants to pee, use the urinal.
For female, eat this one.
Female, this one. You cannot put the urinal.
But it will not like for female.
No. What happened? It will go like this. Okay? So, this one is for male.
Di ba tumalsik eh? Paano yun?
Ano yun? Lalaki yun.
Ma'am, ang taas ng ihi niyo ba?
Lalaki yun.
Babae ba? Hindi.
Tapos na
Ang taas ng ihi mo, ma'am.
tendency yan, bababa pa sa babae. Yan. Okay? Correction.
Ligayang-ligaya si David, oh.
Okay, so, okay, nakaihi na po siya. Okay, remove na natin. So, wash labia majora, different sections of the claw. Okay, then labia minora. Okay, wash. And then one stroke, open it. One stroke from clitoris going
to anus.
anus. Okay, so that is wash. Then we will rinse it. Okay, rinse it. It depends, no. If she prefers to wash it with water, put the bedpan.
Bedpan.
Okay, and then wash it with the water.
Ma'am, we can use also wet wipes na lang. Wala na yung
Towel.
Mas okay kasi yung water yung ano mo. Pag wet wipes, it's preferable to use the water. Okay, then
Sometimes
wet wipes.
because it's cause
Because wet
UTI
wipes, guys,
also.
no?
Alcohol
There is an
base.
alcohol base, ma'am.
But if you
Can
don't
cause
use
irritation.
water,
Irritation
she
as
wants
well.
water, just pour it. Yeah. If you saw the video, there is like one small bottle with a narrow, ano ba yun? Yung matulit, yung
Parang ano lang.
narrow
Test tube.
Yung parang-
opening. Okay, narrow
Oh.
opening. Okay, then you can use it. Okay? So, hindi siya mag-splash. It will not splash. So, if the patient prefer that, we can use that. But, if the patient wants towel, it's okay. So, same technique. Rinse. Rinse.
21.
And then, open from clitoris going down to the anus. Okay? Then, where's my towel? You can use it because this is towel also.
And then what if they have if she have infection?
What?
She has an infection.
What if she have infection or?
I mean, she had menstruation.
Yeah.
Menstruation infection.
No, I mean infection or maybe it's reddish or.
Ah.
Anyway,
You note your assessment.
okay, I'm not. I will not do assessment of the pussy. I'm of the vagina.
Oh, you have to check. Always. Guys, the hygiene, we are doing hygiene not only to clean the patient but also to assess the skin of the patient or the parts we are cleaning. So if we found that there is an abnormal something on the patient, you should inform. Okay? If this is swollen, okay, infection. If there's a lot of okay, menstruation. What if there's menstruation? What you're going to do?
Menstruation.
You still need to clean it, especially
Menstruation, you need to
menstruation.
clean it, but you
Yeah.
ask permission with the patient. Because some patients, they're very sensitive with the menstruation. They're very conscious. They're very shy when someone is cleaning it because it's blood. Their blood. Okay, so you ask them, do you prefer to clean or you want to clean it by yourself? Okay, because some patients, if this hands is working, they can do it. Okay, if their hands is working, they can do it, they can clean it. Okay, that's why maximize whatever the patient can do. Okay, then next, give me the catheter.
The catheter cleaning.
Okay, catheter care.
Yeah. Catheter cleaning.
Okay, so it's okay to do.
Wala doon sa video yung catheter namin. Walang...
Wala ba? Meron.
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 Catheter care.
Yung last hindi na pipling.
Hindi nga.
Ba't ganun?
Joy.
Joy, take it.
Disinfector.
Malaki kasi
Remember?
Okay guys, you are not allowed to insert the catheter, right? Okay, assistant
Sumasagi
nurse
sa
is
mukha
not allowed
Ha?
to insert any
Yung book niya na sasagi sa mukha ko ng
Who is allowed to insert this is the nursing nurse and the doctor.
the doctor. Sayonara.
Okay, so this is how you will do the catheter care. Okay, how many inches you will clean the catheter? How many inches? 4 to 6 inches. Okay, so this is called Foley's catheter or indwelling catheter. Okay, we have 4 types of catheter, right? You have condom catheter. Condom catheter is usually put also with the male patient only. Okay, condom catheter, we have Foley's catheter or indwelling Foley catheter. You have suprapubic. Okay, there is an operation here.
Yeah.
Okay, then they are putting the catheter.
Yeah.
Then they are
Implanted it.
incise, tinatahi nila, stitching it on the skin. Then you have the last one is straight catheter. Straight catheter, this is not straight catheter because there is a Y shape, okay? Straight catheter is really straight catheter, okay? This one but without this. Okay? So this is called indwelling Foley catheter.
lagyan
Indwelling
ng
Foley
tubig.
catheter is to measure the urine
Di
of
ba
the
may
patient.
balon sa loob?
If the patient is having cardiac problems, renal problems, then they want to measure accurately the intake and output. That's why they are putting the catheter. Okay? Now, how we will do the catheter care.
Hindi
Okay?
ganun.
So, same thing, wash, rinse,
Ito pang
and
monitor kasi
dry.
ito intake.
Okay? Wash, rinse, and dry.
Wala kang ano yung
Okay,
pambalon.
so how you will do it? Wash.
Miss, FD ba?
Yes.
Is it also dorsal recumbent?
It's okay. Like this, it's okay. It's fine. No, it's fine.
Lobat ka na.
Okay. So, how you will do it? You hold on this part.
Yeah.
Okay. On this part. Why? So you will not pull it.
Yeah.
Okay. So you hold here. Okay. Then, this is wash. Okay. With soap and water. Then, circular motion. 4 to 6 inches. Okay. Then, go to the rinse, hold here again, and then circular motion. Okay, then of course don't forget to dry it. Okay, dry. Sorry, again. Dry. Okay, now how you are going to place the Foley's catheter, the whole system. Okay, how you're going to put the urine bag. The urine bag should be below the bladder. Okay, so this is your bladder. It should be below the bladder. Okay, why? To prevent ascending infection. Because if you put like this, then it will go back. Okay, the urine will go back to the bladder and it will cause infection. So it should be below the bladder. Then, if you don't have this strap, okay, where you will secure this one?
Thigh.
Okay. For male patient, you need to secure this on the
Abdomen.
lower abdomen. Then, for female patient, you need to secure it for,
Thigh.
on the thigh. Okay, but what is this? Ma'am F, what is this? This is a commercially made leg strap, okay, for both patients, male and female. Okay, for male and female, you will put the strap on the leg. If you have this commercially made, okay, you can get it from the store of your hospital, okay, of your ward, and then you can put it. Both male and female, you put it on the thigh. Okay, but if you don't have this, same pa rin. Okay, same. Male on the lower abdomen, female on the thigh. Okay, so how you are putting it? This is the leg strap. I'll show you how to put it. Okay. Okay, put it under the leg. Okay. I-ano nyo siya, tupiin nyo, fold it because it's very long. Then put it on the middle thigh. Masyado itong malikit eh.
Ma'am, which side does it prefer to be?
Okay, good question. If you are turning the patient on this side, for example, turning nyo, bedridden yung patient. If you want to turn the patient on this side, okay, where you will put this? On this. Okay, always remember where is the patient, the tubes is also there. So you should put there. Okay? Good question. Okay? So, ilalabas nyo to. This one, the where you will secure it. Okay, then on the intersection, Y intersection, okay,
To
you put
avoid
it
the
here.
pulling.
It will not be pulled out.
Oh, it will not be pulled out. Because the tendency is, accident might happen and it can be pulled out.
Push and pull.
Okay? Then it cannot be pulled. Okay? Make sure that it is not kink. It's not kink. Ay, hindi. Parang doon. Make sure that it is not kink. Okay, if you want to clamp it, guys, like this. If you want to unclamp it, like this. Okay, where are you, when you are doing the clamping and unclamping of the catheter? If you're doing the bladder training, you remember what is bladder training? You remember that? Bladder training? Never heard? Who remember bladder training? I talked about that. Bladder training is where you want the patient to be to urinate alone. Okay, if you remove this, then you remove the catheter, then there is a tendency that the patient cannot void alone. Why? Because he became used of the catheter, so he will not void alone. So bladder training is a way wherein you are exercising the patient or telling or teaching the patient to resume or to void again by his own. Okay, so how we are doing it, make sure that the patient is conscious, coherent. Okay, then tell the patient, Mr. David, now we are starting the bladder training. Okay, the bladder training. I will just clamp this one. Okay, I will clamp this one. If any time that you feel the urge to void, let me know because I will unclamp it. Okay, again, Mr. David, I'm going to start the bladder training. Okay, if there is a time when I will clamp it and you will feel the urge to void, the urge to urinate. Okay, naiihi siya, feels to urinate, just let me know because I will unclamp it. Okay, you need to have 3 times urge to urinate, so we will remove the catheter. It means that the patient is ready to void by his own. Nagets nyo ba? Yes. So 3 times. You ask the patient, okay, if you have urge to void, okay, just let me know that I will unclamp it. Okay, this is one way that we will use this clamp. Then, if we are turning the patient, for example, I want to turn the patient on this side, you need to clamp it while you are turning the patient. Why?
So the urine will not come back.
Very good. Okay, but don't forget to unclamp it when you are finished turning. Understood?
Yes.
Okay. Question?
So, Ms. F, since we are not allowed to insert this, right? So, nurse will be the one to put also this strap? Or
No,
or
you
we
can
are the
put.
one?
You can put.
Okay.
That's why I'm teaching you.
Okay.
Insertion only is not allowed. Now,
So you put, Ms. F, you put only the strap when you're cleaning, then afterwards,
no, actually, the strap is already there. Okay? But I just show you how to put it. Okay? If it's soiled, you can change it. Okay? What if,
Pagod, no?
when is the time that you will empty the urine bag?
it's full.
When?
2/3?
No.
When you're
Half full.
Half full.
Half full. Okay. When it's half full, you need to empty it. Where's my urine now? How to empty? Okay, you remember the topic intake and output.
yes.
Okay, intake and output. Okay. So how to open it? Okay, I'll just make it up so you will see. Okay, but I should empty it here on the floor. Okay, what I'm going to do, guys, is I'll get a urinal, a calibrated glass. You see, there is a calibration measurement. Okay, then make sure. Actually, when I'm emptying catheter, I'm making sure that it is. I have double gloves. Why? Sometimes my gloves is carbon. Okay, it become tore. Okay, then I touch this one. You know, the gloves nowadays is not good quality. So I'm doing 2 gloves, but it depends upon you. That's what I'm doing. Okay, then I will remove from here. Okay, then put it here and then push this inward. Okay. Okay.
It's
If
like
you
a
wa-
lock.
If you want to close it again, put it like this. Same. Okay? Then put it back. Yes, you can change it. How to change it? Okay. How to change it? You will just remove it from here. Okay, you will just remove it from here. Okay. Fold it. Remove, change. Get new bag. Usually 7 days. Because it's costly. This one, when to change? If it's leaking. Okay, we cannot change it every now and then. Why? In and out of catheter will cause infection. Okay, if it's leaking, if it's not in place, change it. If the doctors wants to change it, but don't change it every 3 days. 3 days or 4 days. No, it will cause infection.
Because it will be charged to the patient.
Yes, also charge also to the patient. So, what else? Now we'll do the diaper.
Excuse me, madam.
Yes.
Let's say, for example, our patient is conscious.
Huh?
She's conscious, right?
Puta, grabe perennial tsaka diaper isang oras ha.
You are going to change it for...
Hindi mo pinutol?
Hindi.
Yeah.
Wala ka dyan.